Hi, my name is Ressi. I'm an occupational therapist and certified lymphedema therapist. I'm going to show you how to perform manual lymphatic drainage, or MLD, for swelling or lymphedema of the arm. Our lymphatic system is comprised of lymph nodes and lymphatic vessels. The lymph nodes act as filter stations, while the vessels pump fluid through your body toward the lymph nodes to filter out fluid. It's part of our immune system that helps fight against infection. We have clusters of lymph nodes in our neck region and in our armpits. If you've had surgery for breast cancer or radiation treatment, we are going to redirect fluid toward the opposite armpit. For example, if you have swelling in this arm, we are going to redirect fluid toward this armpit. If you've not had surgery for breast cancer or radiation treatment, but have swelling in this arm, we're going to move fluid toward this armpit. When we begin, we're going to start opening up the lymph nodes around the neck region. I'm going to use the flat surface of my fingers or the palm of my hand. As I mentioned, it's a movement of the skin, so I'm not going to dig my fingers into the skin. I'm not going to squeeze my skin, or I'm not going to milk my arm, but I am going to move the skin in the desired direction to help drain the fluid. We are going to start at the neck, placing your fingers, the flat surface of your fingers, along the neck region, moving the skin in a circular pattern, 5 to 7 repetitions. Then you're going to come along the collarbone and move the skin inward toward the neck, 5 to 7 repetitions. You can also do it in this manner if you don't have the flexibility to cross your arms. Next, we're going to do diaphragmatic breathing. Diaphragmatic breathing helps promote movement of your lymphatic system toward the heart, which your heart will then pump fluid through your body. I'm not going to do a chest breath like this. Instead, I'm going to breathe through the diaphragm along the belly. Place your hands along the stomach. When you inhale through your nose, your stomach will expand and your hands will lift. When you exhale, your stomach will fall in and your hands will fall in as well. Take a deep breath in. Exhale out. Think about a 4-second inhalation and a 4-second exhalation. Repeat that 5 times. You're going to start by opening up the lymph nodes under the armpit with the flat surface of your fingers or the palm of your hand. Place it in the armpit and begin to move the skin in a circular direction, 5 to 7 repetitions. Then you're going to proceed to this part of the chest, and you're going to move the skin toward the opposite armpit from where you have swelling. 5 to 7 repetitions of the circular movement of the skin. You can also do a technique called the pump, where you push the skin and you let it go. So you can either do the circular pattern or the pump technique to stretch the skin. Again, you're going to do 5 to 7 repetitions. Once you've cleared this portion of your chest, then you're going to proceed to this portion and continue to open up the pathways. You can use your opposite hand to pull the skin toward the armpit. If you're comfortable using the same side as the swelling, you can use that hand to also move the skin across the chest. You can alternate by doing the pump technique or the circles. But again, you want to ensure that you're moving the skin away from the side of the swelling. And you're going to repeat that technique 5 to 7 repetitions, opening up a pathway toward the armpit. Next, you're going to open the area along the armpit on the same side as the swelling. If you have had lymph nodes removed, you're going to stimulate any remaining lymph nodes or lymphatic vessels in that area. 5 to 7 repetitions of this circular movement along the armpit. Now that you've cleared the pathways across the chest and along the armpit on the same side of the swelling, you're going to proceed to the arm. You're going to start at the top of the shoulder using the flat part of your hand and move the skin in an upward direction, 5 to 7 repetitions. This is my circular pattern. You're going to make your way down the arm and continue to move in an upward direction. Inch your way down the arm, but continue to move it in an upward direction. You can alternate by using the pump technique where you stretch the skin and let it go. And I like to alternate between the circles and the pump. Occasionally, you can bring it all the way across the chest. Next, you're going to proceed toward the elbow. Again, you're going to do your circular movement of the skin, followed by the pump. Inch your way down to the forearm, doing your circles. Followed by your pump. Proceed to the wrist, followed by your pump. Lastly, you're going to work on the hand. You're going to do a circular movement of the back of your hand, followed by the pump. And then you're going to do each individual finger and thumb, doing a circular movement of the skin, you're going to do each finger. If you are somebody that has more swelling in the hand, spend more time moving the skin, followed by the pump. Once you've completed the top part of your arm and hand, you're going to open up your arm, and then you're going to start at the top, moving in an upward direction with the circular pattern. 5 to 7 repetitions. Make your way down doing the same pattern. The circles, 5 to 7 repetitions, followed by your pump. And you're going to continue until you get to your hand. One thing I want to mention is that I never started at the hand. The hand is the furthest part away from your heart. If you have swelling in the wrist or the hand or the forearm and you started here, think about a traffic jam. If I try to move the fluid here, it's not going to go anywhere because you've got a lot of congestion here. You have to clear all the pathways or roadways at the top so that the congestion or the traffic can flow. So just to review, manual lymphatic drainage, or MLD, is a light touch movement of the skin. You want to direct the fluid in the desired direction, first clearing across the chest, clearing the armpit, and then moving at the top part of the arm, the middle part, the wrist, and lastly the hand. Make sure you cover both the top and the bottom so you cover as much surface area as possible. These techniques should be done slowly and performed on a daily basis. Take your time with it and focus on movement of the skin to help reduce the swelling. If you have an infection, if you have a fever, redness, the skin temperature is hot to touch, or significant increase in swelling, contact your doctor before performing this technique to ensure that it is safe to do so. The reduction of swelling can be successful with a combination of MLD and compression bandaging. For more information about how to apply compression bandages, you can check out my other video on my channel. If you found this video helpful, please subscribe so that you can view additional content. Thanks for watching.